Hey, I'm Bella, and with me is Talia, Rachel, Sanya, and Madison, and we're going to go over type 2 diabetes with you.
So we're going to give you an overview of our project. We are going to discuss the overview of type 2 diabetes and then give you the opportunity to learn about the research intervention conducted by the University of Illinois in Chicago. And then we are going to discuss the strategies of prevention used in the research study and explain our recommendations for future studies. And then here's a video we found. So, along with the video emphasizing some key points, type 2 diabetes is the most common form of diabetes. Disease is caused cells in the body not reacting normally to insulin, causing your pancreas to make more insulin as a result. After a while, blood sugar rises, causing many adverse health effects such as vision loss, heart disease, or kidney disease. Common symptoms include, but are not limited to, frequent urination, excess thirst, blurry vision, feeling tired, or numbness and tingling in hands or feet. Tests that can be done in order to diagnose type 2 diabetes include an A1C test, fasting blood sugar test, glucose tolerance test, and random blood sugar tests.
So the study that we looked at is a research study or an intervention conducted by the University of Illinois in Chicago by a couple of researchers, and it's called the Healthy Living Program. And this program was based on the Diabetes Prevention Program, which was a huge study. It had close to 4,000 people involved in it. And it was a clinical research study that lasted about a year. It was based on an intensive lifestyle program where people were put into lifestyle groups. And the results of the study is that it showed that weight loss through dietary change and exercise reduced the risk of developing type 2 diabetes. But up until this research study was done, there hadn't been a program that had been tailored specifically to the Latino community. So this research study served Latino populations specifically. And this is especially important because Latinos have an increased prevalence of both obesity and diabetes in the United States. They're also disproportionately affected by diabetes as they have higher rates of kidney failure, vision loss, and blindness associated with diabetes. And this higher risk is associated with a lot of things, but the top three are genetics, food. If you think about the cultural food in Hispanic culture, there's a lot of beans and rice, high carbohydrate foods, which contribute to diabetes. And then also weight/activity. Being a little overweight or obese in a lot of Hispanic countries isn't seen as necessarily a negative health problem. And so it was really important that this study focused on Latinos.
The study consisted of two different phases. In phase one was the community-based screenings, which included free screenings for high blood pressure, kidney disease, diabetes, in addition to glucose testing and evaluations on the participants' weight from the Kidney Foundation of Illinois, which was from the used volunteers and staff to actually do the screenings. The screenings were held in various places, just like hospitals, public schools, service centers, and a federally qualified health center. And they just did this as the access for everyone in the community to be able to have these screenings done. And then in addition to this, the study sent out flyers and posters to many places like local businesses, schools, hospitals again, just to promote the study and let everyone know. And then lastly, the participants met with a nurse practitioner from this program and who pretty much just once the screening was completed, they provided feedbacks on the screenings and clinical referrals for the participants if needed. And then in addition to this, if the participants met the study guidelines, which consisted of being overweight but not necessarily obese, they were referred to a research team to actually join the study. And then for phase two, which was community translation of the DPP lifestyle intervention, weekly sessions were held at first, which then shifted to monthly sessions, which focused help meet the study's goals and objectives, like losing up to 7% body weight or body fat, and increase physical activity just to help promote and generate a healthier lifestyle overall. And then to help really incorporate the public, they hosted public forums and had regular community advisory board meetings. And then also in addition to this, they had community members actually become program staff members to have their input and really be a part of the program. And then to ensure that the program was tailored to the Latino community, they emphasized culture-specific information in regards to the population's risk and the prevalence of diabetes in that particular community. And then just to actually promote a behavior change, the participants were provided with materials to help generate a change with multiple educational nutritional books, pedometers, self-monitoring tools such as personalized weight charts, scales, along with some measuring cups. And then lastly, the study provided small groups in the community that consisted of around about 9 people, and they included a community leader who served as their healthy life coach, which just gave them suggestions and support to the participants and really just led them along this journey. And then regular walking groups were encouraged tremendously during this just to promote more physical activity and have that social support aspect. And then to determine if the study was really successful and there was a behavior change, follow-up data was collected at a 6-month time period and after a year, which included measuring for their weight, BMI, their body fat percentage, and then also in addition to information about the individuals physical activity levels, their dietary habits, stress levels, and their attitudes and beliefs towards the community and the program itself.
So this program focused on primary prevention throughout the resources and education it provided, with the measuring cups and nutritional pamphlets and things like that were shipped to increase their participants to have healthier diets and just make better lifestyle choices. The walking groups was their way of incorporating more physical activity, which both physical activity and healthy diets have been known to help delay or prevent the onset of type 2 diabetes. The program mentioned that all of these forms of prevention were used to delay it in this specific or delay it in the Hispanic community because these are common risk factors which can, if fixed, they can decrease its type 2 diabetes prevalence.
Some recommendations we have for this study are helping participants maintain long-term regular physical activity by identifying strategies to support the initiation and maintenance of physical activities. Although there were significant changes found at 6 months for several measures of physical activities, these changes were not maintained at 12 months. We also suggest implementing a control group to be used as a benchmark to measure how the others tested subjects do, using a larger sample size and adding more male participants since 92% of the participants were females.
So basically overall in this presentation, we talked about type 2 diabetes and how it just refers to the body becoming resistant to insulin. We discussed the different ways to diagnose it, basically through, there's multiple different tests you can take, blood glucose test, A1C test, all those to help verify whether or not a patient does have type 2 diabetes. We talked about the program, the Healthy Living Program, and how it was based off the Diabetes Prevention Program and how they specifically targeted delaying or decreasing the prevalence of type 2 diabetes among Latinos. It was also a very community-based program, and it offered lots of resources and sessions and things like that to help accomplish their goal. And we also discussed the primary prevention methods that they use to make their program happen and what they based their interventions off of. Additionally, we talked about our recommendations for them and how we think that tweaking a few of their possible adding control groups or who their participants were increasing the diversity among the Latino group, i.e. adding males, could also, or increasing males could help make it a better program. Thank you so much. Here are our references.